Assalamualaikum. You're watching program Health is Wealth and I'm Dr. Tahira on PTV World. Today we are talking about surgical oncology. Why? Because it is very important to actually diagnose, detect something that is growing inside your body on time, because that is when it can get treated. So you say na, nip the evil in the bud. Timely diagnosis saves lives. So to watch all the symptoms and to detect yourself so that you can be treated on time, please watch our program today. Assalamualaikum, I'm Dr. Tahira and you're watching Health is Wealth. Welcome to yet another interesting episode. And today what are we discussing? We are discussing how a stitch in time saves nine. We often have so much going around in our body, but we just don't pay heed to it. And the only time we go to a doctor is when things have really crossed our heads and there's nothing and everything becomes irreparable and the damage is irreversible. So today we're going to talk about how timely diagnosis of most cancers is very important and how their surgical treatment is the only way out of it, because the moment you figure out that you're suffering from certain cancers and there are surgical options available, very new options are available, you can be cancer free in no time and you don't have to fear the monster you've been calling cancer for so long and feel scared of it. So today we have with us Dr. Sohaib Haider. Thank you so much for joining us. He's an associate professor of oncology, surgical oncology, specializing especially in colorectal surgery. So we will be discussing with him in detail colorectal cancer, a very important cancer, very less talked about, but seriously a very big killer these days. Thank you so much for joining us.
Thank you so much.
So let us start with colorectal cancer. I don't know why people don't speak as much about it, though it is a very aggressive killer. And now that we have a treatment for it, I think more and more people should be talking about it. What exactly is colorectal cancer? The first things first.
Yeah, basically the colorectal cancer is cancer, or some say that's sort of a malignant cancer, which is originate from large bowel or large gut, having different parts, for example, the colon or the rectum, where the fecal matter is stored and the patient when feel the urge to pass it out. So basically it is a cancer related to the bowel. As according to the research, the colorectal cancer is very highly prevalent nowadays, because let's say it's a third or fourth leading cause of a death in the cancer patients. That's why that is very serious much problem.
And what are the reasons? Why do you think the high incidence of colorectal cancer? Is it because of our diet that has processed fats and processed diet and all these high nitrite and ammonia and all of that? What is the reason?
Yeah, obviously. Broadly, we divided into terminologies or two categories. One is the non-modifiable causes, in which the genetics and the family plays a major role. If a father or someone in the family has been diagnosed colorectal cancer or any type of cancer, there is a high chance that his or her gene has been transferred to the offsprings, and that's why. This is a non-modifiable. We can't change that. The other broader category is the modifiable, in which you have already told you that it is a processed, especially the processed meat, artificial things, a sedentary lifestyle, smoking, not our community, but in the Western community, the alcohol plays a major role for the formation of these cancers. Actually, the cancer is, these are all the different types of body cells, which is running unprogrammed.
Right.
So that's why they grows and overgrow, and the body can't control them.
Right.
And these unprocessed things and the artificial things, artificial diet and these sort of things, they change the genetics, they change the genes which basically control the cells.
Right.
And if the genes and the mutants, they become a cancer.
So basically all the cells in our body have to be constantly dividing, and if this dividing mechanism or software goes haywire, and that is usually because of these artificial substances, that's when it starts producing, the oncogene starts producing uncontrolled, just like our population is going uncontrolled and it's running a haywalk, the same way when uncontrolled proliferation of all these cells causes what is called a cancer or a tumor. So when we use the word tumor or cancer or it's the same thing? Are we referring to?
Unfortunately, it's a misconception
Okay.
in the
All right.
population. The tumor basically is an outgrowth of a cell.
Okay.
It can be the benign or it can be the malignant until unless proved otherwise.
All right.
So basically, the person or the people when they spoke or hear there is a tumor, they become afraid that this is a cancer and he or she might gonna be died.
Yeah.
It's not. Tumor is basically the size or
localized
increased number of the cells.
Okay.
And it can be benign or it can be the malignant. The malignant one is called the cancer.
Okay.
The benign one is controllable.
Okay.
And the malignant cells, the cancer, they are unprogrammed.
Right. So basically, this is a condition. Cancer is a
Yes.
condition where the entire body starts to go into an uncontrolled state of division, cell division.
Yeah,
so you said tumor, it could be malignant, it could be benign, it can be removed, but a cancer is going to metastasize and spread to other places.
Yes, obviously, it depends upon the nature, depends upon the grade, and depends upon how the cancer or how the cells behave.
So we were talking about how tumor is different from cancer, and you said tumor could be benign, it could be malignant, and once it is malignant, it's called cancer. So tumor could be just an overgrowth of cells in a certain place which can be removed easily, whereas cancer is an entire condition where the whole software has gone and it is proliferating all these cells, and we have to cut that, we have to catch that, nip the evil in the bud, right? So when we were speaking about colorectal cancer, what is the age group that we are ideally looking for? When should a person be going for screening? Because it's said that, elderly men especially are very susceptible to it. What age group, what body type, what genetics?
Usually the age group is above 50 years all over the world generally, but it has been seen that here in Pakistan, we have seen some very younger population, like in let's say 20 or 25 plus. The patient came here with having the colorectal cancer.
Right.
So basically, it's not actually exactly the age because the whole pattern has been seen changing. The genetics, yes, obviously it's very much important, plays an important role. Here in Pakistan, unfortunately, there is no as such screening program. Generally, people when they become sick, they used to treat by themselves. This is a major drawback here.
Right.
So that's why they have not been diagnosed properly and timely.
Right.
This is the main the concern here.
Okay.
Otherwise, let's say in the Western countries, there are programs, there are screening programs. If someone get or diagnosed colorectal cancer, they are the male offsprings and the male child, they have been entered into the program for a certain age group. They have been certain types of investigations and clinical on the basis of the clinical judgment. So that's why it's important here to do frequent investigations, and the screening program has to be started.
So what are the symptoms of colorectal cancer? When we say somebody might be suffering from colorectal cancer, what exactly are they having?
Yes, altered bowel habits, number one, in which patients sometimes say that they have the constipation, and sometimes they say that the bowel habits have been changed. Now patient
diarrhea.
has passed the diarrhea, the loose motions. Bleeding per rectum, very much important.
So you can see actually fresh red blood, and you can see very dark stools as well.
Second one, the hemoglobin level decreases due to that blood loss, either the ongoing or the little bit amount. There might be the mass, patient feel there is something heaviness or at the abdomen, mass, and other constitutional symptoms, for example, weight loss, sudden weight loss.
Right, loss of appetite.
Yes, loss of appetite, paleness, lethargy, weakness. These are all constitutional symptoms which usually occur in every sort of type of the cancer.
So nutritional deficiencies, you said anemia is one cause, like for example, the hemoglobin is really falling, you're getting short of breath, you might be developing some kind of pigmentation. You would know you have anemia. What other nutritional deficiencies are there with colorectal cancer that people can look out for? Because they start loading themselves with multivitamins and everything, and they see they're not improving.
Yes, obviously, that's why I have told you before. The major issue is that the patient, they usually take the
take
medications.
Supplements.
That's why if any symptoms or any change in the body or any altered bowel habits whatsoever, any symptoms he develop or she develop, should consult with the
And
physician
you
as well.
said that there is weight loss as well as loss of appetite, nausea, which is the generalized conditions in cancer.
Yes, obviously.
But in the specific colorectal, it is more about the bleeding, more about the mass. Is there bloating,
Yes,
distension?
obviously it can be bloating, it can be the patient has an urge of incomplete evacuation.
Okay, tenesmus as
Yes,
well.
Yes,
Yes.
this is a
Okay.
tenesmus patient. Oftenly go to the washroom to
Because they keep
to
thinking
empty
that
the
they have
bowel.
washroom and very little keeps coming
Yes,
out. They
that's
keep having
because
pain.
actually the tumor cells, they when increasing in size, they actually narrowing the passage.
Right.
And this is the narrowest of the passage causes all sort of this.
And all these symptoms, are they like constant or they keep coming and going when you're in the initial stages of cancer? Because a lot of people say, you know, I had this for 1 month, then I was okay for another month, then again I had it for 2 months, and then again. Is it a constant thing or does it keep coming and going?
Actually, it's slowly and progressively constant.
Okay.
It's not say that the patient had the symptoms and suddenly it disappeared.
Yeah.
Because the cancer cell slowly and gradually grows and increases in size. It basically slowly and gradually blocks the passage. And
Right.
that's why patient when notice the first symptoms and these symptoms progressively
Okay.
increases with the maybe there is a chance that he will develop another symptoms.
Okay.
But for example, initially there is a constipation or bowel habits. Then after some time he noticed that whenever he passed the stool, there is a blood coming out.
Right, exactly. And they have these nausea and loss of appetite as
Yes,
well, because
obviously.
heartburn, and because they keep confusing it with gastric symptoms and keep going to doctors and taking antacids and, you know, all these proton pump inhibitors. First they go to that, then they start going to Hakims and take more mercury and all those,
Yes,
you know.
Unfortunately, our social system is just like
Yeah,
that. It works
yeah.
just like that.
And do they confuse it with hemorrhoids as well many
Yes,
times?
obviously. Yes, obviously. But important thing is timely diagnosis.
Okay.
Timely patient goes to the nearest physician, the competent physician, obviously, and clinical examination is very much
Okay.
important. Clinical examination about the clinical history examination,
Right.
and after the doctor concerned physician.
But it is very important for the physician to refer somebody to an oncology surgeon as well if they suspect it. The problem is they don't refer.
Yes, obviously, this is unfortunate
Yeah.
another social
Yeah.
sort of a problem here.
Yeah.
They want to treat
On
that
their
by
own,
themselves.
yes, and all these medications, and they keep delaying and complicating the
Yes,
case,
obviously,
right?
This is also
Okay, so now what are the investigations where you need to tell everybody that if you're having all these symptoms, what are the investigations that a doctor is going to give you and which you should be going for?
Yeah, first examination.
Okay.
Detailed examination, for example, like proctoscopy, sigmoidoscopy, or the colonoscopy. And second, if let's say it's not available, then we suggest the patient to go for the fecal occult blood test.
Okay.
In which if there is
Blood, it will
there is
show.
initial phases of symptoms.
Right.
There is no obvious bleeding. Patient
Frank blood is
not
not
frank,
there.
yes.
Yeah.
This will tell the somehow there is some sort of a disturbances or some sort of a problem related going on. Then obviously scopes.
Okay.
This modality has totally changed the dynamics, totally changed the diagnostic purpose,
Okay.
because via the scope you can exactly see the exact the area, the ulcers or any
Right.
pathology,
Right.
and you can take out the biopsy.
Okay.
And if this biopsy basically proves or confirm the diagnosis, sort of 100%, and after that there are other, if it proves to be the malignant one, then the staging purpose.
Okay.
The staging basically to look for the any metastasis, to look
Right.
for any other organs which is involving by that pathology or not.
Right.
And in which there are other investigation for the CT scan or the MRI, depends upon the type, depending upon the grade, depending upon the disease. Patient to patient varies. After this, all different types of the screening, investigations, and let's say the diagnostic and metastatic work, then the exact stage of the patient, stage of the disease, actually they have been diagnosed, and after that, depending upon this different types of stages, the treatment, because there is no one set treatment available, there are multiple treatments. And
Before going to the treatments, I'd like to ask you, like a lot of patients are diagnosed with, you know, inflammatory bowel disease, that is ulcerative colitis and Crohn's disease, or they have IBS IBS, which is
Yes.
irritable bowel syndrome. So does sigmoidoscopy and all these scopes, does it actually rule them out? Is it a better way to go for a sigmoidoscopy right away so that they can actually rule these other things out instead of just taking medications for it constantly and ruining the rest of whatever remains as well?
Yeah, the scopes, the sigmoido or the colonoscope is exactly the best diagnostic tool because the biopsy or the area which there is a pathology or any ulcer or any change of the cells is seen during the scope. You take out that a small chunk, and during the histopathology it will confirm the proven out.
Right.
Either it's benign or which type of benign, for example inflammatory bowel disease, or it's a malignant one, the cancer of the colon.
But
or
the
whatsoever.
symptoms are very similar of all
Yes,
three of them, right?
Obviously, it's some sort of same symptoms, but the diagnosis is through
Very
the biopsy, and
Yeah.
biopsy has been taken via the scopes.
So for an irritable bowel syndrome, you will probably giving relaxants and all of it, treating them a little more psychologically. For the other ones, the inflammatory ones, you're giving those disease-modifying drugs, proper
yes,
drugs,
obviously
right?
there are multiple options available. Conservative management, for example, dietary habit, change the dietary habit, and there are the different types of medications, and obviously, and yes, there is also availability of a surgery if it's a complicated case in inflammatory bowel disease. For example, if there is a blockage, complete obstruction, or if there is a massive bleeding, and if there is a failure after the medication, or the multiple relapse of the disease. So
now, if we have diagnosed, the biopsy has come back that the person is suffering from colorectal cancer. So you said the surgery is the option. So surgery involves what? Resection of that part of the colon or all parts of the colon that are affected? How aggressive is this surgery? How much time does it take? What is the downtime, recovery period? Because people are scared of surgery. The moment they hear the word surgery, they're scared of it. So can you please tell them how important it is to timely diagnose it and then get it treated, surgically removed so they are free from it instead of it spreading and spreading and spreading?
Surgery is not only the modality available.
Okay.
There are other modalities of
Radiation
the treatment,
and all
and it totally depends upon the type of a cancer.
Okay.
It totally depends upon the location of the cancer.
Okay.
It depends upon the staging of the cancer.
Okay.
Let's say we divided the cancer into 4 stages. Stage 1 is very early. It's a very confined cancer.
Okay.
Stage 4 is metastatic. Metastasis to the other organ. For example, liver or the bone or any other part of the abdominal organ or away from the abdomen. So it totally depends upon how the patient behave, how the malignancies and these are sort of the staging scenario. In a rectal area, if there is a cancer proven out, usually the patient has been advised for chemotherapy or the radiotherapy cycles. So medical oncologist is on board.
All right.
They give the chemo and the radiotherapy depending upon
so
type,
it can be either medicines, it can be either radiation,
yes, obviously,
and surgery.
and then reassessment of the patient. Either these medicines or this treatment has worked or not, and now what is the current stage after taking this treatment? Then the surgery. So if say that there is a patient who has a cancer at the colon at the left side, lower descending colon. So usually after the whole investigations, after the diagnosis, we generally, and the best way is we discuss that patient in multiple disciplinary meeting, where obviously it's a very good concept here in where I'm working. We are doing this very oftenly, where certain different consultants of the different area, they sit together, they discuss the patient and best possible options for the treatment purpose which is available has been advised. And let's say if there is a early stage cancer at the colon, left descending, not involving the rectum, partial resection, left hemicolectomy, depending upon the size of a tumor, depending upon the segment which is involving. Surgery, we usually advise the patient to first go to the surgery, and after the surgery, when the patient recovers from the surgery, patient put into for the chemotherapy or the radiotherapy, depending upon the medical oncologist and depending upon the disease. So it is not exactly the modality, surgery is only one. There are other options. For example, in certain different types of cancers, there can be the hormonal therapies, there can be the immunosuppressants, different types of chemo.
So we were speaking about colorectal cancer, and you said these are the different modalities. But now you were telling me that a lot of new, ways of surgery have also evolved. A lot of advances. Before, everything had to be cut open, and the whole abdominal cavity was exposed. But now there are little cameras and probes, and the incision is small, and everything gets done. And there's some robotics and AI and everything in it. So what are the new interventions in this surgery? What exactly is happening here in where you're working? What is your expertise in this surgery, and how is it different from the conventional surgery that we used to have?
Previously, it has been said the big surgeons give the big incisions.
Exactly.
Now the
and it doesn't heal. There is infection. There is
obviously. Now the whole scenario has been changed after the advancement of minimal invasive surgery.
Exactly.
Through which we use certain different types of tools. We give a small incision, just about 1 to 1.5 centimeter different incisions. We insert that instruments which is called the laparoscopically, and we perform the surgery. The result of this type of surgeries obviously is better as compared to the open one, because good and early recovery, minimal scarring, minimal bad aesthetic looking scars. Patient underwent or goes to normal routine very quickly.
Right.
And yes, obviously robotics. This is also very new advancement in which patient has been performing surgeries via the robot, in which there is the better view for the as compared to the laparoscope. And yes, obviously there are other different types of surgeries through which we go via the rectal area, via the anal canal area, in which there is no need for the incisions or in the abdominal or the. So that is also sort of a minimal invasive.
Okay, so a lot of people used to have colostomy and ileostomy. Is that still there, or?
It's there. It is a part of the treatment, and it totally depends upon the type of cancer and the location of the cancer.
Okay.
And yes, it can be temporary, the stoma formation, or it can be the permanent.
Okay.
Depending upon the type of the cancer.
If somebody has this bag outside their body and they have this hole and this tube and it's permanent, don't you think they have a lot of complications and it's very difficult? Or
yes, obviously.
So hasn't medical science advanced enough to get rid of that thing as yet?
There are changes, but it's some sort of a temporary, because whenever you resect a bowel or resect some portion of a bowel and do the anastomosis, naturally it has some time to heal up.
Okay.
And in a cancer patient, if you resect, there is a chances of a relapse in some sort of a every cancer, in which we give the patient some time duration, in which we regular follow up the patient, regular do some sort of scopes, screening, different investigations, blood investigations or scans, to rule out relapse to rule out the recurrence of a cancer.
Okay.
So because there is a highly chance that some small size of a cancer cells has been left, although it's very negligible, but anyhow. So when certain time duration has been passed out, then this stoma, they will like normal routine, they will anastomosis and so yes, it's really problematic regarding the patient to care for the stoma, and it's obviously psychologically very disturbing, because the normal routine work of the patient is disturbed due to that stoma, the bag, and also. But it's sort of a necessary.
Okay, so when we talk about grading and staging of cancers, we've often heard of the term TNM also, tumor, and then if there's involvement, the size of the tumor, the involvement of the nodes, metastasis.
Yes.
So when they talk about grades, they were saying how close it is the shape of the cells to the original form, so the more differentiation, and then they talk about stage, it's that. So can you tell, because people get scared with these words, stage 1, stage 2, stage 3, or that there's grade 1. So what are the grade and what are the stage where they have hope, and till what stage and grade should they give up? They should never give up, but still.
Yeah, obviously. First thing is, fortunately, unfortunately, the disease, if occurs, then there is obviously the patient, they fear that it's only the death sentence, but it's actually not. The grading is basically how the cell behave, how the cell increases in size, and how the aggressiveness of cells. We divide grading on the basis of under the histopathological slides. Grade 1, 2, 3, 4. 4 is very advanced sort of a thing, and 1 is very similar looking cells to the normal one. Staging is basically we divide the cancer cells depending upon the size, depending upon the lymphatics, lymph node involvement, and depending upon the distant metastasis.
Right.
Distant metastasis means that these cancers has been spread to the other parts of the body.
Okay.
There are 4 types of stages. Stage 1 is very early. As I have mentioned, it is the cancer which is confined to the area where it has been originated. And stage 4 is if they are metastasized to the other area. For example, in CA rectum, if the cancer involves to the urinary bladder, because it's very close, or if involves the liver, or the cancer cells is spreading to the bone, it is at advanced stage. In early stage, the curative rate is very high. Because you can cure. Cure means if you remove all the disease, let's say 100%, or if in cancer it's not 100%, more than 98-97%, then the probability of disease free after the treatment is very high.
Okay.
As compared to the stage 4, because in stage 4 multiple organs has been involved.
Okay.
So it's sort of an aggressive tumor.
Okay.
So this should be.
And you also mentioned before that it is a multidisciplinary approach where everything is combined, like the chemotherapy, the radiation.
Yes.
You said hormone replacement or hormone therapy as well to shrink sizes, along with the surgery. So all these modalities combined will be giving a person a holistic entire treatment. This was all about the large intestine. What about the small intestine? What kind of tumors or cancers are found in the small intestine, and what is small intestine bowel obstruction or SIBO or whatever we call? What exactly is that, and how do you differentiate?
Yeah, the bowel obstruction basically, imagine there is a pipe of water. It's just like,
Okay.
whenever there is something, there's some problem which blocks the passage.
Okay.
This is the bowel obstruction.
Okay. It could be a tumor.
It can be tumor. It can be the benign one. It can be any other thing. For example, foreign body. It can be some other sort of benign disease. For example, tuberculosis or structure formation. It can be the malignant one. The incidence rate of malignancy in a small bowel is less having less incidence as compared to the large bowel.
Okay.
There are other different types of cancer. For example, neuroendocrine cancer is also present in the small bowel.
What are the symptoms of that? Like feeling very hot and flushing and
basically,
sweating?
these all different types of diseases causes the narrowing of the passage.
Okay.
And so patient usually complains with abdominal pain, crampy pain especially.
Okay. Spasms and all of that.
Yes, obviously spasm, crampy pain, bloating, fullness, and later on with the vomiting, nausea, and constipation. These are all different types of symptoms which usually patient presents with.
And what about gastric carcinoma? They say a lot of people who eat a lot of spicy foods and all of them, and have ulcers and they have spoilt that ulcer, so it does become a gastric carcinoma. How prevalent is that? They say it's very common in Japan and areas like that.
Yes, obviously the main thing I think in Japan is due to the dietary, as you have mentioned earlier.
Okay. They have a lot of processed food, sausage and all of that.
Processed food, not properly cooked.
Yeah, all raw sushi and all those foods.
Yeah, these are all different types of. That's why Japan and at that region.
They have a lot of stomach cancer.
There's a lot of stomach. The other thing is certain type of infection, for example,
H. pylori.
H. pylori, because it's a bacteria, it's a microorganism which resides, and later on it can convert into the
bacterial overgrowth as well.
Yes, cancers.
Okay. So what are the symptoms of that cancer, and that also can be resected via surgery?
Yes, the symptoms basically bloating, fullness at the gastric region,
gas,
vomiting, dysphagia, unable to pass later on,
unable to eat and swallow, and
these are all different types, and the constitutional symptoms, as I have mentioned, these are all different types of cancer. It totally depends upon the staging of a disease.
Okay, so which stage?
Usually, the gastric cancers, when patient present with the gastric cancer, usually they are advanced stage.
Okay.
Unfortunately, and during that stage,
so this cannot be detected via sigmoidoscopy. So endoscopy is going to solve it.
Yes, obviously endoscopy, upper GI endoscopy. This is also a type of a scope through which we can see the different areas where the cancer cells or where different types of ulcers or any other pathology which is appearing or seen. and we have taken out the biopsy, and during that biopsy,
Okay, so when somebody is prescribed an endoscopy or a sigmoidoscopy, what is the procedure? Because it's very scary, right? First of all, and what are the things they need to do before and after? How much is the downtime? How aggressive is it? Because people think the moment they're going to go for such a scope, it's going to perforate their gut and they might die on the table, which is a very common myth all around.
During the with the passage of time, with the advancements, it's not very much scary.
Okay.
Usually, patient come to the clinic in the same sitting. After some time, within 1 or 2 hours, the scopes has been arranged or the scope has been performed, and the
so you don't have to be like NPO and anema.
Yes,
and
obviously,
all of that is there.
These are the preparations we needed, and they can be done in the same day.
Sitting is that?
Yes, same day.
Okay, very nice.
Same day, and the scopes and the biopsy has been taken, and the patient has been discharged on the same day.
So it's nothing to feel scared of.
Yes. The problem, yes, obviously there is a chances, but it's the incidence rate is very low.
Right.
It's not very.
So we don't have to fear it as much.
Yes.
What is an ideal diet for a good gut? Because people are nowadays prescribing and telling a lot about probiotics and giving some live cultures, and there's so much of stress on this, and then they're saying, these laxatives, stool softeners, all is not good. You should be taking a lot of husk and fiber and xylem, and less raw and less spices make sense, less nitrites, less processed, less salt is fine. But can you please tell how important are these probiotics and the husk, involvement of fiber or husk in diet? Is it good or bad?
Whenever we go far away from the natural things, all the artificial and these sort of things during the diet, they cause the problem.
Right.
Whenever we come closer to the natural diet,
right,
or
so
let's say organic diet.
Yeah. The village
nowadays,
diet.
This is the terminology we are using, organic diet.
But real organic diet is actually village diet. Even the labeled organic diet is not very genuine nowadays.
Obviously, these sort of things are present here. Then there are chances of far away from the disease, and obviously other modifiable things in which diet plays an important part.
So they shouldn't be taking these probiotic supplements.
No need for, because these are all different types of things, or the multiple vitamins and all things are present naturally.
Okay. And what about these food intolerances people are so obsessed with nowadays, like celiac disease and lactose intolerant and
yes, obviously these are all present here in the population, general population, but because the problem is that they has not been diagnosed properly, so that's why they are problematic.
And people who have like H. pylori or a gastric ulcer, does this constant irritation of an ulcer or its presence lead to ultimately cancer?
Yes, obviously the cancer cells, why they become so much
different,
because mechanical trauma. Mechanical trauma is just after during the ulcer formation by the microorganism, the bacteria H. pylori.
Right.
What is going on? It become naturally heal, and the organism present, it resides there. They causes again trauma, heal trauma. The whole cells, they become altered. The whole genetics of the cells which are controlling themselves, they become altered. And when this alteration has occurred in the genetics, so that's why the cells which become healed after that, they will proliferate and uncontrolled. They become are transformed into the cancer cells, or they metabolize.
Okay. So in our part of the world, we are very, very prevalent in hepatitis B and C, and we leave it because it's a latent disease, doesn't show up. We leave it as such, and then it finally becomes liver carcinoma. So how do you deal with liver carcinoma? Because the symptoms at that time are, very advanced when the symptoms start showing. And what is the prognosis for that?
Usually hepatitis B virus, they transformed and form the complication of that. The liver become, the carcinoma has rise in the liver. That's why the early detection and the screening is very much important.
Right.
Whenever the patient came, or for example, let's say with any other pathology, there is a mechanism has been devised that patient has been screened or has been tested regularly to sort out all the patients which is having the disease of hepatitis B or C and which has not been the present.
Right.
If the patient has been diagnosed, then the properly follow up, so that these type of patients, they are not undergone into the transformation of a hepatic cellular carcinoma.
Okay.
So the repeatedly different types of screening.
But if somebody does get that cancer and they start having this jaundice and nausea and water like ascites or all of that, and so then is resection of the or the liver or liver transplant an option for the cancer?
It totally depends upon the stage.
Oh. Okay.
All depending upon the stage of a disease. If it's an early stage, then there are different modalities for a segmentectomy or the area where the malignant cells have been
Okay.
present. In a very advanced stage where we can't do any other thing
Yes.
than the transplant.
Okay.
So this is sort of an advanced stage where we cannot resect a particular type of a
Right.
cancer, or when the cancer cells have been spread to different locations of the
Exactly.
liver, so that we have to remove and transplant the new
So,
liver.
what is cholangiocarcinoma or pancreatic cancer? How common is that, and how do those symptoms present as opposed to the liver one? Liver one, we just spoke
Yes,
about them.
ma'am.
So, what are the symptoms of that?
Cholangiocarcinoma, basically it's a malignant carcinoma of bile ducts.
Okay.
Bile ducts, basically these are the channels which connected from the liver and excrete all the bile which is formed in the liver, and different liver secretions.
Right.
They exit and enters into the small bowel
Right.
in the duodenum. And this, all the secretions are important for the digestion purpose. If any malignancy occurs in that ducts, this is called the cholangiocarcinoma. Unfortunately, cholangiocarcinoma is a very aggressive form,
Okay.
and the modality of the treatment for the cholangiocarcinoma is very limited.
Okay.
Although, but the life expectancy, unfortunately, is shorter as compared to other different types of
Okay.
cancers.
And what about pancreatic cancer?
Pancreatic pancreas is a hormone which
okay.
has
Insulin
insulin
producing.
and other
Yeah.
exotype and endocrine
Right.
gland. If any malignancy, especially usually the incidence of a malignancy is present at the head area, and which block these type of ducts, bile
Okay.
ducts, and the patient present with the jaundice or
Okay.
the other different types of constitutional symptoms. Yes, we have a
So,
modality.
are
of-
you operating for pancreatic and cholangio and all of these cancers as well? All right.
It also totally depends upon the stage where
Okay.
when the patient presents the pancreatic, there is we perform the pancreatectomy and all different types of the.
Because we've covered this area in detail, let us come to the most common, the breast cancer. It is spoken a lot, we speak a lot about breast cancer. It has a lot of, publicity attached to it. And I think the reason for that is because it was a taboo in the past.
Yes,
So can you
obviously.
say how much is the incidence of breast cancer, and how has early detection actually helped? And, how many, mastectomies are you doing regularly, and how is the prognosis of those patients?
The breast cancer, yes, it's very much prevalent in the females, and
Hmm.
unfortunately, yes, our social system is just like
Yeah.
that, as you mentioned the taboo,
Right.
because the females of family,
not tell
they
anybody.
are very reluctant
To share that
share with
information.
the family members.
Right.
And that's why this disease has been very prevalent in our society. And unfortunately, when the disease has been spread and has become advanced, now they come to the physician and
Exactly.
say, so that's why the probability of the life expectancy is very less.
Right.
That's why the awareness is very much important, and I think all the people here in Pakistan, they are doing a wonderful job.
Yes. So, what is the age group mostly? You will see more breast cancer prevalence in which age in women?
The age group has been started after the menarche usually.
Okay.
In
All
the
right. So,
adolescents,
young girls can have
younger-
it, and older girls.
Yeah, they can, any age group.
Okay.
The best age group, not say the best, the exact age group is usually after 40 to 45 years.
Okay.
But we are seeing very younger age group in which the
Okay.
patient came here.
And what do you think is the reason for this high incidence of breast cancer? Is it the use of a lot of oral contraceptives, or is it the use of hormone replacement therapy after menopause, or is it this, artificial lifestyle where they're using these broiler chicken and egg? They're saying that also has a role to play. Does it have a role to play or no? Anything that plays with the hormones?
Any type of cancers, anywhere
Right.
in the body, usually due to modifiable or
Yes.
unmodifiable causes.
Okay.
Like I have said, some sort of a genetics which plays an important role, especially in the breast cancer or
The
in
BRCA
the females.
gene?
Yes,
Yeah.
if the gene is present, there is a high chance that the patient has been getting the breast carcinoma or the uterine carcinoma later on.
Right.
And obviously the dietary modification, and yes, late menarche is plays an important role. Nulliparous is also.
So not having
plays in the
children
hormonal
or getting
therapies.
married late, or
Yes, these are all different factors which plays an
important role in the formation of
breast
breast cancer. And we always stress upon self-examination. If there is a lump, change in shape, changing texture, discharge, all of that is known to people. What else could be a symptom that people should be, actually very cautious of? And because a lot of people are speaking against mammograms these days, so are you one of those? Should they be having a regular mammogram in case they are above 40 and they have a family history of cancer, or should every woman be going for this unnecessary radiation or not? And is only self-examination enough?
No, the self-examination is just one part of
Okay.
for the diagnostic purpose.
All right.
It has been called the triple assessment basically. Self-examination is one of that triple examination part. Any change in the breast,
Size and shape.
any size or any swelling or any lump, any different types of discharge from the nipple area or areolar
Inverted
area,
nipple,
any change
yeah,
in the
dimpling appearance,
yes, obviously.
everything, yeah.
So that's why self-examination is very much important.
Okay.
Once in a month, every female has to be examined by herself at least.
Right, yeah.
And if she found anything, any change, should consult the physician.
Right.
And mammography is the second part in the triple assessment.
Okay.
Mammography or the ultrasound. It depends upon the age, depends upon the type of the
Right.
swelling, and so basically. And that basically helps for the diagnosis purpose.
Okay.
And after that, biopsy. Biopsy is the third one.
Okay.
Yeah, people also fear about that if some iron enters into the, and they can.
Then it will start spreading more.
Yes.
They think that.
Unfortunately, this is also yes in some
So
different.
FNAC and biopsy, how are they different? Because people know that there's one fine needle aspiration, cytology, and biopsy is taking out a piece, right? So do they prescribe both of them, or in different cases?
It depends upon the
type of the
type.
lesion.
FNAC basically shows the type of cells, only
Okay.
cells.
Okay.
But in biopsy, we
The tissue,
we
entire
take
tissue.
the tissue, but it's not with the blade.
Yeah.
There are different types of needles.
Yeah.
The size of needle a little bit wider as
Yeah,
compared
the
to
punch,
the finishing needle.
right, yeah.
So it's very say that it's very easy, not fearful for the patient to take out the biopsy. And biopsy basically we take the chunk and perform the histopathology exactly under the slide, whole detailed examination, and that will confirm exactly what type of cancer and what are different receptors and what different types of treatment.
Okay. So when
according
we
to
talk
that.
about the surgery, there is a lumpectomy, then there is a mastectomy, then there is a radical mastectomy, then there is the reconstruction. So if you could tell everybody, depending on their stage and everything, that these are the different, treatment modalities combined with chemo and radiation, and then they'll be completely free of the cancer. So if you explain the different kinds of
obviously
surgery.
there is also a different modality for the surgery, the chemotherapy, the hormonal therapy, depends upon the type of cancer, depending upon the grade of the cancer, depending upon the stage of the cancer.
Right.
In early stage, there is a highly chance that if after the treatment, after the chemotherapy and after the surgery, the breast conservative surgery, this is very
Right.
much important because it's a part of the body, parts
Exactly.
of the female, and they don't
Want to lose it.
get rid of
Yes,
the whole
exactly.
tissue. So if it's the patient came in early stage, if the size is very small, and if the metastasis or the stage has been done,
Right.
so the patient has been advised for only that area along with the small rim of the normal tissue to be removed, and the breast, the contour of the breast, they has been preserved.
Okay.
And later on, the patient has been put on the hormonal therapy or the chemo depending upon what type of cancer, and a regular follow-up, regular screening, so that the relapse of that cancer could not be occur again.
A lot
And
of,
if there is a multicentric, if the sizes increases of or if there is a metastatic or the advanced stage, then unfortunately we have to remove all the breast tissue. But the chemotherapy, the radiotherapy, and the hormone therapy is also going on depending
with
upon the type, grading, and it means that there is not only a single modality.
right.
Let's say we only perform the surgery and remove all that area,
Right.
then there is a highly chance that the relapse has been
Might
occurred,
be.
the disease
So
comes
if
again.
once a patient, any cancer for that matter, has been treated, how frequently should they be screened in case, because a lot of people start getting relapses, and what is their prognosis after getting a relapse? Can they be treated again?
Yes, different type of cancer has the different time frame. For
Okay.
example, we follow the patient after 3 monthly, then
Okay,
the 6
6
monthly,
months,
or 1 yearly for the consecutive 3 years, then 3 yearly for consecutive two times,
Right.
then the 5 yearly. It totally depends upon the type of a cancer, type where the cancer has been rising, and the treatment
Right.
and type prior to the treatment. It
Exactly.
totally depends upon that.
So a lot of people have made medicine very commercial lately, and they're using a lot of implants for women in terms of silicone fillers, silicone implants, and fillers, hyaluronic and other fillers. So does it play a role in actually causing cancer? Can it turn dangerous? Because it is at the hands of very inexperienced people, especially injectors. They're not even doctors in most cases, and they're just injecting anything and everything.
Yes,
for
that
augmentation.
has to be sought out and ruled out that
Yeah.
if they are injecting certain type of drugs, because
Yeah.
certain type of drugs they can also causes cancer.
Exactly.
They are carcinogenic. They can be.
So when we talk about carcinogens, what exactly is carcinogenic? Eating in a plastic, microwave, all the dyes, what?
They're carcinogenic because basically these are all different type of let's say the chemicals or anything which plays an a role for they transform the cells, the functionality of the cells.
Yeah.
They can be the diet, because some type of people they are not prone to it can be certain type of medicines, or
Right.
can be certain type of different types of chemicals,
And all these unhealthy
approximately.
lifestyle.
Yes, these are all basically they can cause the cancer formation.
Okay.
They can change the type of a cell and metastasis.
So what was
This is
your
the
reason to choose oncology as a field, and how much is the incidence of cancers in Pakistan, and how satisfying has been your experience in making people cancer free?
Here I have been working for more than 5 years in the Dr. Akbar Niazi Teaching Hospital, initially as a general surgeon. Then new field has been arising here. The new field has been started here in surgical oncology, as well as especially the colorectal.
Okay.
And it's a proud for us that Dr. Akbar Niazi Teaching Hospital is one of the pioneer and one of the first institute where the colorectal surgery has been recognized by the College of Physicians and Surgeons.
That's nice.
And that's why I have been enrolled, because we are seeing a lot of patients
Okay.
prior to that.
Okay.
And all different types of patients, especially the cancer patients.
Right.
And yes, it's a very difficult in our community, our Pakistani people, because the diagnostic tools and the treatment is very lengthy for the patient.
Right.
And this is one of the major drawback that the patient presents very lately and very advanced, because they have to come very frequently. They have to due to the social system and due to the financial system.
So it becomes
it's a
difficult
very
for
sort
them.
of a burden. So the incidence is very high here.
Okay.
And due to there's no screening programs
Right.
which are running in different areas. So that's why these type of patient basically they become neglected.
All right.
This is one of the reason I have to enter here, and I get a chance to work.
All right.
And
Thank you so much, Dr. Sohaib. Haider, it was a pleasure talking to you. Thank you for your message. Thank you for everything, and thank you. We are very grateful for your time. So we had with us a surgical oncologist who explained to all of you in detail how important timely diagnosis is, and now you don't need to fear it, neither the diagnostic test nor the treatment modalities available, because the incision is going to be really small, the procedure is going to be very small, painless, blood-free, bleeding-free, infection-free, and with very little downtime. Thank you so much for watching. Inshallah, we'll meet you next week. Allah Hafiz.